Welcome everybody to the June meeting of the Access Health. Marcin, do you want to give your usual introduction?
Yes, Mr. Chair. This meeting is being recorded for minute-taking purposes, as well as for posting of the recording of the proceedings on the agency's website. This meeting is also being live streamed on the Access Health CT website. This meeting is also being recorded by CTN for a later broadcast. Thank you, Mr. Chair.
Thank you. I think to begin with introductions. So if I could ask each of the board members to introduce themselves or recognize their presence. This is Charlie Klippel.
Thank you, Mr. Chair. Paul Philpott, Vice Chair.
Here.
Grant Ritter.
Here.
Deidre Gifford.
Present.
Steve Hernandez. Thank you. Steve Hernandez.
I'm here. Thank you.
Thank you. Matthew Brockman.
Here.
Thank you. Thomas McNeil. Mr. McNeil.
Here.
Thank you. Dina Berlin. Andrea Barton Reeves, DSS Commissioner.
Here.
Thank you. Mr. Sean King from OHA.
Good morning. I'm here.
Good morning. Thank you. Claudia Gualtieri from OPM.
Here.
Thank you. Eleanor Malfredi from Connecticut Insurance Department.
Here.
Thank you. Dr. Manisha Tutani, DPH Commissioner. And Caroline Zambetti, designee for Nancy Navarrete, DMS Commissioner.
Here.
Thank you.
Thanks very much, and great to be with you all again. Could I ask the staff on management of Access Health to introduce themselves too, starting with you, James?
Thank you, Mr. Chair. Good morning, all. James Michelle, Access Health Connecticut.
Gina Walsh, Director of Operations, Access Health Connecticut.
Lisa Wick, Director of Finance, Access Health Connecticut. Rebecca McClear, Director of Technical Operations and Analytics, Access Health CT.
Susan Rich Bai, Director of Legal and Governmental Affairs, Access Health Connecticut.
Caroline Rouette, Director of Marketing, Access Health CT.
Good morning, John Carbone, Director of Small Group Product Development and Broker Support.
Good morning, everyone. Glenn Jurgen, Director of Human Resources, Access Health CT.
Marquise Davis, Director of IT, Access Health CT.
Thank you. I think that's everyone. So thank you very much. We have a busy agenda today. I understand we have no public comment. Is that correct, Marcin?
That's correct, Mr. Chair.
Fantastic. So we'll move to a vote to consider and then approve the minutes from the last meeting. Do I have any comments on the minutes of the last meeting? If not, could I get a motion to approve the minutes of the last meeting?
Yes, I
no,
motion to approve.
Okay, Marcin, I'll let you sort out a motion.
I'll second that.
Second from that.
So
Thank
Steve
you.
Mr. Hernandez made a motion and was seconded by Dr. Grant Ritter. Is that correct? Okay.
All good.
Is there any discussion on the motion before us?
Hearing no discussion, Charlie Klippel, yes.
Thank you. Paul Philpott.
Yes.
Grant Ritter.
Yes.
Deidre Gifford.
Yes.
Steve Hernandez.
Yes.
Matthew Brockman.
Yes.
Thomas McNeil.
Yes.
Dina Berlin. Andrea Barton Reeves.
I'll abstain because I wasn't present at the meeting.
Thank you. Sean King
Abstain.
and Claudia Gualtieri.
Yes.
Thank you.
Thanks all. We have a late breaking item to add to the agenda today, which requires, I think, 2 votes. One is to add it to the agenda and the other is to approve it. And Susan, if you would be so kind just to tee up this issue and then we can do the votes for you.
I will. Thank you, Mr. Chair. So since this is a regular meeting, it is within the board's power to vote to add an item to the agenda. We were notified by the Department of Social Services yesterday that they had gotten approval for some actuarial work that they need done that they would like to use Wakely for the Covered Connecticut program. So we are asking the board to amend the agenda to add this item. And then after that vote, I can give you a little description of the actual other vote that is needed. Thank you.
Sorry, great. Thank you, Susan. Yeah,
Sorry, I was
please.
just going to make the motion to add this item to the agenda, Mr. Chair.
Thank you so much. Second?
Tom McNeil, second.
Thank you, Tom. Any further discussion on adding this to the agenda? If not, Charlie Klippel, yes.
Thank you. Paul Philpott,
Yes.
Ron Ritter. Dr. Ritter. DJ Gifford,
Yes.
Steven Hernandez,
Yes.
Matthew Brockman,
Yes.
Thomas McNeil,
Yes.
Dina Berlin, Andrea Barton Reeves,
Yes.
Sean King,
Yes.
and Claudio Galtieri.
Yes.
Thank you.
All right. Thank you.
This
Susan?
is Dr. Ritter. I say yes.
Oh, thank you.
Thank you.
Susan?
Thank you. Yes, so the item that we would like to add, that we've just added to the agenda, is DSS's request to use Wakely for actuarial services. DSS requires the services of an independent actuary that is familiar with the marketplace population to conduct an analysis and develop methodology to assess utilization in the Covered Connecticut program, to inform a rate for payment to the carriers for the risk associated with zero cost share plans. So Access Health will enter into an SOW with Wakely, who it has engaged for the next 3 years for actuarial services to perform this work, and the cost of $450,000 will be paid 100% by DSS. Accordingly, the DSS costs in the AHCT operating budget will be increased by the addition of a separate line item for this $450,000, making the DSS costs in the operating budget a total of $21,450,000. And then this will also change the total operating budget for Access Health for the whole operating budget, excuse me, for FY26 will be increased to $63,032,293. Access Health now asks the board for approval for this additional expense of $450,000 to be added to the FY26 operating budget pursuant to the requirement in Access Health's policy titled Adoption of Annual Budget and Plan of Operations. I will pause. Thank you.
Sorry, I was on mute. Any thank you, Susan. Any discussion of this item that we should hear before?
Mr. Chair, just for purposes of adding a little context here, Susan, help me understand. As I understand it, when we started Covered Connecticut, there was a request that we add a premium surcharge, essentially a program participation fee, recognizing that the patient population, the customer base, may act differently if everything was entirely free subsidies and no cost sharing and no deductibles. And as a result of that, we had started with a program fee that was quite high. And as we looked at the use experience, we've been able to successfully negotiate that down. So this is just building on that work to successfully calibrate what, if any, or modest adjustment in program fee may be needed to make sure that carriers can remain solvent and continue to provide Covered Connecticut. Is that right?
That's correct. And then this will provide a methodology going forward, for each year to have it all in place. So thank you.
Excellent. Thank you. Just wanted to give some context. Appreciate it.
Andrea, did you have a comment or question?
No, Susan answered the question. I didn't know if Claudio needed further explanation or if the board did, but I'm fine. Thank you.
Okay. All right. Thank you for the clarification. Any further discussion of this matter? If not, then I would ask for a motion along the lines that Susan outlined to add this into the budget for the Access Health.
Mr. Chair, would you like to spell out the motion, or?
Feel free if you'd like to be more specific about that
Okay.
motion.
Okay, motion to add $450,000 to the fiscal year 26 operating budget for actuarial work needed to be performed by Wakely for the Department of Social Services for the covered Connecticut program that will be paid 100% by DSS.
Perfect.
Thank you, Mr.
I have
Chair.
a motion to approve that.
Yes, hi, this is Grant. Motion to approve.
Thank you, Grant. Second?
This is
Paul,
Claudio. I'm
Mr.
happy to second.
Okay, again, I leave that to you, Marcin.
Happy
But-
Claudio. Mhm.
all right, thank you. Any further discussion? If not, Charlie Klippel, yes.
Thank you. Paul Philpott.
Yes.
Thank you. Grant Ritter,
Yes.
Deidre Gifford.
Yes.
Thank you. Stephen Hernandez,
Yes.
Matthew Brackman,
Yes.
Thomas McNeil,
Yes.
Dina Berlin,
Yes.
Angie Barton Reeves,
Yes.
Sean King,
Yes.
and Claudio Gautieri.
Yes.
Thank you.
Terrific. Thank you all very much. We'll turn to the regular agenda, and James, that's your report.
Right. Thank you very much, Mr. Chair. Good morning, everyone. I'm James Michelle, the Chief Executive Officer of Access Health Connecticut. Welcome to the last board meeting of our fiscal year. As you know, we recently shared information with you regarding the One Big Beautiful Bill Act, also known as the Reconciliation Bill. It is now with the Senate for its consideration. If this bill passes, it will have significant impact on our customers. I have worked with my colleagues across the country to provide information to the members of our federal delegation about the impact and changes we expect. Some important changes include the shortening of the annual open enrollment period by 1 month, additional paperwork requirements, making it harder to sign up and qualify for financial help. It is also anticipated that the enhanced subsidies that were introduced in 2021 as part of the American Rescue Plan Act and extended through the Inflation Reduction Act will expire at the end of this year. We will continue to keep you updated as this process evolves. We have no idea where it's going to go, but it is moving forward in the Senate. Also, I also wanted to share that we are ready to go live with our new Business Plus platform in just a few days on July 1st. Business Plus is the rebranding of our ICHRA platform that we've been developing over the last year and a half. This platform simplifies the health benefit management process for Connecticut business owners. It also provides access to additional coverage options through this platform. We have provided demonstrations of the platform to our carriers, as well as our members of our state legislature and the broker community, and have received a lot of great feedback from all of them. Recently, we demonstrated the platform for CMS, and they were very pleased with what they had a lot of questions. They were very pleased with what they saw, so much so that they've asked us to demo it for all of the state-based marketplaces on June 26th. So we think that there's something going on there. And Susan will share with you, there's a part of the Big Beautiful Bill that speaks to small businesses using ICHRA to benefit their employees. So I like to say that we were way ahead of the curve, but we just happened to start working what's best for our small businesses in Connecticut. As a result of that, they will be able to take advantage of the changes that have been proposed in the bill, if it doesn't change. Finally, I would like to express my thanks and appreciation to Paul Lombardo, who will be retiring at the end of this month. Paul represented the Connecticut Insurance Department Commissioner on our board. He also served as a member of the Strategy Committee, was a subject matter expert on the SHOP and Health Plan Benefit and Qualification Advisory Committees. His calm and strategic thought process is greatly appreciated. We wish him well and also a long and prosperous retirement, and thank him for his service to this board. Congratulations to Paul. Our meeting today We'll begin with a detailed presentation of the reconciliation bill from Susan Richby, Director of Legal and Government Affairs. Following that, John Carbone of SHOP, Director of SHOP and Product Development, will present a brief demonstration, a high-level demonstration of the new Business Plus platform that I just talked about. Then Susan will report on the fiscal year 2025 annual financial and programmatic audits. And she will also give you an update on the state-based marketplace annual reporting tool for 2024, and also our state audit status. After that, John Carbone will return with a recap of the Small Business Summit that was held on May 20th in Rocky Hill. This event was fully booked for the third year in a row. We were happy to welcome speakers, including Connecticut State Comptroller Sean Scanlon, State Senator Matt Lesser, State Representative Kerry Wood, and Department of Administrative Services Commissioner Michelle Gilman. Our keynote speaker was Michelle Nicholson, the founder and owner of the Flower Girl Bakery in Hebron, who shared her inspiring business story. We thank everyone who attended this event. Then John will come back very quickly to give you an update on the Broker Academy, who is now in its 4th year. The program continues to be very successful and very popular with the communities that we serve. And this year, our Broker Academy graduates will play an important role in supporting employers and employees as they navigate our new platform, so business could take advantage of the ICRA process. Mr. Chair, at this point, I will stop talking because we have a lot going on. But I would entertain any questions anyone has for us. Me.
Terrific. I think Dr. Gifford has a question.
Thank you. James, is it going to be part of the presentation later to talk about specifically what's in the reconciliation bill with respect to, besides shortening the enrollment period? Were you guys planning at all to talk about the other impacts, or can you or Susan elaborate if it's not part of the later agenda?
No, it is. We will cover everything that's going to impact us across the state of Connecticut. Then we'll answer any questions we had also. We did a similar presentation last Thursday for the strategy committee.
All right. Thanks, James.
Yes.
Any other questions? So we're going to turn this over to Susan to do that. Just before we do, let me express on behalf of the board, all of you, our thanks to James, to Paul for his service on this board. It's been great to have him with us. So thank you to him. And without further ado, Susan.
Thank you again, Mr. Chair. And yes, we will go through all of the different provisions that will have a big impact, most importantly on consumers and also on Access Health. So this bill really changes how and when consumers will enroll, the paperwork required for them to enroll, and very critically, the premiums that they pay. So these are really highly important to people having and maintaining their coverage. So as James mentioned, we've sent information on this. I believe we've sent it to the board, and we've shared a lot of information for our work with our other state exchanges, with our federal delegation, and also with state officials, so everyone is aware. So I've broken it down into groups to look at it. So first we'll look at enrollment restrictions. As James mentioned, one of the items in there that's also in the proposed rule, and a lot of these items are also in the proposed rule as well, is shortening the open enrollment period to November 1st to December 15th with no flexibility for states. Previously, state exchanges have had flexibility to, go a little longer, start a little earlier than the FFM. They are proposing that everybody would have to keep to the same time period. They are also eliminating marketplace eligibility for deferred action for childhood arrivals DACA recipients, which they only gained this year in 2024. And this change is set for January 1, 2026. The changes take place some in 26, some in 27, some in 28. So where I have information on that, I'll point that out. They also are proposing to eliminate eligibility for financial assistance, the APTCs, and cost sharing reductions for most non-citizen groups. They're proposing to only allow it for green card holders, this very small group, which I don't believe we have a lot of in Connecticut, of certain Cuban immigrants, and also what are referred to as COFAs, the Compact of Free Association. And I don't know that we have anyone with that status enrolled in Connecticut. So they're proposing to eliminate a lot of previously lawfully present immigrants in Connecticut and elsewhere. They're also proposing to eliminate eligibility for APTCs for green card holders who have not yet met the 5-year bar for Medicaid. They have to have the green card, be a lawful permanent resident for 5 years to be eligible for Medicaid. So previously, consumers in that place were able to enroll in a plan and get financial assistance even if their income was below 100% of the FPL, which normally they would not be eligible for this financial assistance. They're also proposing to eliminate eligibility for financial assistance for consumers who are not eligible for Medicaid due to the work requirements. They're kind of extending it, not putting a work requirement here, but saying if you aren't eligible for Medicaid because of the work requirement, you also cannot get financial assistance through an exchange. So the change for the green card holders with income below 100% is also for 2026. And I believe the change for the other groups of immigrants that would no longer be present, this is asylees, parolees, refugees, people with student and work visas, is for 2027. Obviously, all of this is up for negotiation in the Senate right now as well. If you go to the next slide, Marcin. The next group we'll look at is auto renewal process limitations and verifications. This has gotten a lot of attention in the press, talking about eliminating auto renewal. While it does not specify eliminating auto renewal, it puts into place all of these requirements that would in essence eliminate it for various different groups. It proposes to require pre-enrollment verification for eligibility for financial assistance. And the consumer would no longer be able to have that financial assistance while they were still verifying their information. Up until now, there's been presumptive eligibility. You enrolled. If you look like you were eligible, you would be granted eligibility. And if there was an inconsistency in something you said in your application and something from a federal data source, you would have 90 days to submit information. They're proposing to allow you to enroll but not receive that financial assistance until you verify your eligibility, excuse me. They're also proposing to require minimum payments for consumers who have an APTC that covers their entire premium, like a $5 payment, until they come in and actively update their application and show their eligibility. They're also proposing pre-enrollment verification for special enrollment periods. This is one item that actually is not an issue for us because as all or most of you know, we've been doing verification, pre-enrollment verification for special enrollment periods since about 2017. So that one actually we're okay on that one. They're also proposing to remove the special enrollment period for low-income consumers that's been in place since 2021. Consumers with income below 150% of the federal poverty level. They're also proposing to change the requirement for failure to reconcile to the exchange, not granting eligibility from 2 years, which it's been for the last few years under the Biden administration, back to the 1 year that it actually had been for many years previously. They're also requiring consumer verification if the IRS data is unavailable. We ping the Federal Data Services Hub for everyone applying for financial assistance. In some instances, a fair amount of instances, we either get an error code back from the IRS or we get no information, and then the consumer has to verify. For the last about 2 years, we were able to accept the consumer's attestation in that instance, but that will revert back to the way it was previously. And then they're also shortening the income verification period. Under the Biden administration, the 90 days for income verification had been extended to 150 days. They're proposing to take it back to the 90 days. Now, the provision that's kind of gotten the most attention here, the pre-enrollment verification for financial assistance, that one is set for January 1, 2028. So not right away for 2026. And then the one about that I just talked about, if data is unavailable from the IRS, that one would go in 2026. And then they're also proposing changes to QHP benefit designs, which will make plans less rich for consumers. In some cases, our consumers are a little protected because of some of the rules that we have in place, only allowing our standard silver plan at silver. They are relaxing the AVs, so decreasing plan value, but because of our requirement of only having the standard silver at silver, we've kind of protected our consumers from that. They're also proposing to make changes to the premium adjustment percentage, which will increase enrollee costs as well. If you go to the next slide, Martin.
Susan, can I ask a question?
Sure.
On the pre-enrollment verification, what is it exactly that has to be verified before they can get the financial assistance? And how does it get done?
All of the eligibility factors. So it would be income, it would be household size, residence. It's kind of everything, and it actually has a vague provision that says and additional items that the HHS secretary might add. So it's basically everything. There's a lot of debate about what they actually mean by this language, whether it means we can't use the information from the hub or not, whether it just means the consumer has to come in and every year and update their application, so they can't just be auto-renewed. They have to come in and update their application on anything, or they have to actually upload documents to verify all of those elements, which is obviously going to add, tremendous burden to consumers, confusion, and also adding a lag of time, as people have to get this information uploaded, and then we have to have it looked at and verified. So there's a lot of discussion and debate on that. The Senate Finance Committee just came out with some of their language earlier this week. And one of the items that they tweaked a little bit was in the case of birth of a new child or divorce, because there was a lot of advocacy talking about how hard it would be that parents with a new baby don't have a social security number right away, that it would take them several weeks to have that kind of information. So they did tweak that a little bit in the Senate version to have an exception, if you will, in those instances, so that people wouldn't have that long lag with trying to get a new child on. But it would be pretty much all of the other elements of eligibility that have to be looked at. That normally we check our federal data sources, and even at auto renewal, we run the batch and we check them, every year. So they are checked every year with the federal data source. We don't necessarily make a consumer come in and touch their application if they don't have anything to update.
So this has staffing implications for Access Health?
Tremendous staffing, budget, increased confusion, call center. We have technology. We have to make changes
technology as
for
well.
the system. Yeah.
The amount
So
of work we have to do, Dr. Gifford, in terms of preparing our staff to minimize the risk of somebody having a gap in coverage is going to be a heavy lift, more expense than we budgeted. So we're putting together a strategy now, but we don't want to jump the gun until the bill is finalized and signed and we know the exact dates. Once we have that, we'll put together a strategy and work with the chair of the finance committee, then come to the board before we do anything. But right now we are planning and we're planning for the voice right now. But once everything is finalized, then we'll adjust our strategy and price it and come back to the board, finance then the board before we do anything. But we've been dealing with this for the last 6 months. It's a lot of moving parts, but we are thinking going out about 18 to 24 months.
Yeah, and obviously, the risk that everyone is most concerned about is that consumers, being confused or not able to make the effort or not able to get verified and losing their financial assistance and then not being able to afford the premium and dropping coverage. That's what we're obviously the most concerned about.
And obviously, the people who go through all the problems, trouble doing that, and people who need their health insurance, and that'll create a burden for everybody down the road when you only have sick people buying health insurance through the exchange. So everybody pays the price for that down the road. And the impact on hospitals as well in terms of uncompensated benefits. So this will have statewide implications. So that's why we got to do our best to make sure we minimize the risk of people going without health insurance.
Thank you, James. Marcin, if you want to move to the next slide. And then I think this is probably, no, there's probably another slide after this. So another item is consumer financial protection. So since the beginning of the Affordable Care Act and the financial assistance, there have been caps on how much low-income consumers have to pay back when they file their taxes and they reconcile, and they may have been off on estimating their income. They may have earned more than they had previously thought or listed in their application. They have to pay those amounts back to the IRS when they file their return and reconcile. But there have been these caps in place to limit the amount that low-income consumers have had to pay back. In some cases, APTCs can be $8,000, $10,000 for the year, depending on the consumer's age and their premium costs. So they're proposing to remove those caps completely, which would be a huge financial burden on low-income consumers. They're also proposing to allow carriers to require payment of any past due premiums before a consumer can effectuate for a new plan year. And this similar rule had been in place since in 2017 for a few years under the first Trump administration. And in that iteration, it was only for the previous plan year. In the current language, it talks about any past due premium owed to that carrier. So this also, presents a financial hardship to a lot of low-income consumers. They're also proposing to change the premium payment thresholds, what the carrier considers as fully paid or paid in a month. And then one that I know we've talked about before on the board, prohibiting the use of tax credits for gender affirming care. They're also proposing to reauthorize the funding for the CSR payments, which if you just read it, it sounds like, oh, that's a good thing. It actually is a bad thing for consumers because since those were pulled back in 2018, states have used silver loading to make up that difference to the carrier for those cost sharing reductions. And the silver loading actually has had a very positive impact for consumers across the board, especially those not even in silver, those buying bronze or gold, because it has made APTCs bigger. They've had a load on top of them. In Connecticut right now, it's about 10%. So that has actually helped a lot of consumers. So if that goes away, and they're proposing that for 2026, that would be a big change to APTC amounts and silver premiums. Also a really challenging point in the year, in the cycle, for the insurance department and regulators in every state who are currently reviewing insurance rates, proposed insurance rate filings from the carriers. And then they added another twist to this, that they would prohibit federal funds for CSR payments for plans that cover elective abortion. And for us, our silver plans all cover elective abortion. So it's really unclear. We've had many conversations with our colleagues how that would actually play out. Would that mean that they wouldn't make the payments in Connecticut and we could still have silver loading? It's very unclear. So a lot of discussion on that. And I believe that item is still in some of the Senate language that came out this week. If you go to the next slide, Marcin. Oh, Commissioner Reeves, yes.
Thank you. I just had a quick question about elective abortion, or are those categorized as those that are outside of the Hyde Amendment exception?
Hyde
Is that
Amendment,
what
yes. Yes.
Okay,
Yep.
all right.
So they're
Thank you.
proposing that they would only pay for plans that limited any coverage for abortion to Hyde only and did
Got it.
not cover
Okay.
non-Hyde. And our plans all cover, thank you, non-Hyde, to get a little wonky.
Thank
But
And then
they
the
cover
last
them,
item,
but isn't it true that the consumer has to pay for the rider, right?
the
Susan?
consumer, the consumer, it's not necessarily a rider, but that portion of premium has to be a minimum of $1 per member per month.
Yeah,
It's included in the total premium, and APTC has never been allowed to be used for
Right.
that $1 per member per month for plans
Right.
that cover it. Yeah, but what they're proposing is that they would not make federal CSR payments to plans that covered non-Hyde, and our
right.
silver plans cover Hyde. So it's very
Even
unclear
though,
how that would
even though
actually
the
work.
benefit is already carved out from the APTC support,
Correct.
it's more of a punitive extension of just if you offer this period, we're not going to allow the APTCs.
Correct. It's kind of, they're making a real policy statement on those services. And that is one of the items that I believe is under review or will be under review by the parliamentarian in the Senate under the Byrd rule, about whether that is going too astray of budget itself and getting into policy, that aspect of it. That is what we've heard. Thank you. Marcia, next slide. And finally, this is the last slide. This is what James was mentioning before. There is one positive that was in the House bill, some changes to individual coverage health reimbursement arrangements. Positive for us because we're well positioned to take advantage of this. They are proposing to codify those regulations that have been in IRS regulations and CMS since 2019, I believe it is. They're proposing to change the name a little bit. They came up with a way to use the word choice, custom health option, and individual care expense arrangements. But it's basically the same. And they are proposing a positive change that would actually be a good thing for Connecticut employers, to allow employees to use an employer's cafeteria plan to pay their portion of premiums for on-exchange plans. Up until this point, they could only use a cafeteria plan to pay their portion of premiums with an ICHRA contribution. For an off-exchange plan, this would actually extend that to an on-exchange plan. And they're also proposing to create some federal tax credits for small businesses using a choice arrangement. So this would be $100 per employee per month for the first year of an ICHRA or choice, and then it would drop down in half, $50 per employee per month for the second year. So this is one of those ironic items that we are actually very well positioned for Connecticut businesses and small businesses to take advantage of this with our ICHRA and Business Plus platform launching in the next few weeks. So as James mentioned, oh, sorry.
I just want to add that we're the only state. Go ahead, Claudia.
No, go ahead, James.
I was gonna say we're the only state in the country that's prepared to take advantage of this policy if it stays in. Just want to give a plug to our team for having the foresight. Thank you.
Thank you, James. This is Claudio. Just a quick question to Susan, if you could. How is small business defined? Do we know? Is it 50 or under?
The 50 or under, yeah. The ACA definition of 50 or under, yep. And as James mentioned on one of the earlier slides, obviously, if this all does get finalized, we will work on creating massive outreach plans to consumers, working with our health equity and outreach departments and all of our partners and our marketing team to get the message out to consumers to help try to mute any negative benefits, negative impacts to them as a result of these changes. But we know that it's not all going to work, but we're going to obviously we will do our best.
Unfortunately, we have a framework. If you remember when Medicaid Unwind was going on, we had to develop a whole strategy on outreach, and this would have to be mostly in person. And when the bill is finalized, we'll know exactly who the people who will be impacted, at least our current customers who will be impacted negatively. And we could do some very targeted outreach in person as well as email, text, call. So we're gonna do everything we can to make sure those folks know what they have to do to maintain their coverage.
It's a place where we need the broker's help as well, right? So, Susan,
they're going to be part of the strategy, yes.
Yeah. Susan, thank you very much. A complex and moving target, and we really appreciate the update. Any questions, further questions or clarifications Susan can add to her really great presentation here? Okay. All right. Well, again, thank you for doing this, and we will hear from you at the next meeting and the next meeting, and then as we take this on board, we'll be very interested in obviously the technology and the communications as well as the substance of this. So thanks very much.
Thank you.
Great lead in to our next presentation by John Carbone.
Good morning, everybody. John Carbone, Director of Small Group Product Development, Broker Support here at Access Health. I'd like to share a brief update on the progress we've made with our Business Plus platform. As many of you know, Business Plus is our new ICHRA-based solution designed to help small businesses here in Connecticut offer health benefits in a more flexible and affordable and modern way. Instead of selecting a single group health plan, employers now can set a defined monthly contribution. Employees can use those funds to choose an individual plan that best fits their needs. We're on track for our full launch July 1st, and the platform is now in its final stage of development. A major area of focus at the moment has been training and readiness. We're already trained over 150 brokers and have more than 250 additional brokers in session scheduled over the next couple of weeks. Our carrier partners have also completed their training, are fully prepared to support our broker community, our employers and employees during our rollout. In addition, we've conducted a live demonstration of the platform to the Connecticut General Assembly, the Center of Medicare and Medicaid, and the Center of Consumer Information and Insurance Oversight Committee, highlighting the platform's innovation and our commitment to the national best practice and consumer choice and transparency. We're working closely with Anthem and Connecticut to fine-tune our platform, our quoting logic to ensure the plan designs are presented clearly, our enrollments are accurate and delivered on time, and our broker community is part of the process, helping our employers and employees pick plans and evaluate choice options. Our marketing and outreach side, we're preparing to launch our broker toolkit, ramp up on small business engagement, support adoptions through our local events and chambers, partner up with associations, and also conduct webinars throughout the state. As we've already to look ahead as well, we positioned to respond to the custom health options and individual care expense, also known as choice. If enacted, it will reinforce the value of our platform like Business Plus by encouraging broader access to ICHRA-based models across the state. Our early investment in training infrastructure and carrier collaborations means we'll be ready to scale quickly and will lead the way in delivering affordable coverage options to Connecticut small businesses. We're launching with a baseline of 5,000 members in our first year ending in 2026, but we see this just being the beginning. Based on our current market trends, broker engagement, and employer demand, we project a steady growth over the next 3 to 5 years and expanded our goal to 15,000 to 20,000 members. As the individual market continues to mature, and if legislation like Choice Bill is enacted, Business Plus will be an essential tool to help Connecticut small businesses enroll in a covered plan. To help bring this experience to life, our partner Newfield Technology is here today. We'll be sharing a visual overview of the platform so you can see exactly how Business Plus will work for our brokers, employers, and employees. Thank you again for being part of this important work and everything you do to support small business here in Connecticut. So at this time, I'd like to turn it over to Kunal over at Newfields Technology. Kunal?
Thanks, John. Yep, I'm sharing my screen. Hi, everyone. Good morning. So this is the Business Plus platform from our test environment. And this is going to go live, as John mentioned, on July 1. And this portal is going to be accessible for brokers, employers, and employees. On the homepage itself, we have provided some information upfront on what the broker community can do. They can register and onboard new employers. They can compare different financial models on this platform, create employer-specific quote, help the employer or the employee manage their respective account. And we have ensured that this platform is seamlessly integrated with the existing HIX technology as far as the security and compliance goes as well. So our existing brokers can just use their existing credentials to access this platform, and we don't have to onboard them again onto this. Similarly, for employers, they can define their contribution levels, set up their customized ICRA program, monitor plan enrollments, do the payments, including their contribution levels for the employees directly through this platform, which will be transmitted to the carriers. And for the employees, they can view if they are having affordable ICRA, and on the basis of that, if they need to make decisions on if they want covered CT benefits, or they want to check their eligibility for APTC, or they want to continue with ICRA in case they have affordable ICRA available. So I'll start with the broker. So as a broker on my dashboard, I'll be seeing all the businesses who are currently my clients on my dashboard. And for my demo, like, I'll just select one of the businesses, which is named Iconic Tech Limited. So the entire information is going to be available. And if any information needs to be edited out, the broker can make those edits themselves. Similarly, the classes which have been set up for that particular employer are going to be available. So we start usually with 4 standard classes in accordance with what IRS defines for ICRA classes, like full-time salaried employees, full-time hourly employees. And of course, if something needs to be changed, like some class needs to be taken out or the contribution amount needs to be updated, there is flexibility to change all of that. There can be age-based contribution, or if they're salaried, or if they're part-time seasonal workers. So we can customize the setup for each employer. Then we have the employer-specific census, which is available. The employees can be added directly on the portal, or there is flexibility to get the data in an Excel spreadsheet and upload it directly into the system. And all the information will be uploaded over here. And this entire information will be directly available to the employees when they start with their application as well. So that way they have to enter less information and do less number of clicks to complete their enrollment. Then the broker can set up the quote for the employer compared with their current contribution level, so the businesses can make a decision accordingly on if it makes sense to go on ICRA. The quote history can be looked at. Then for the payments, what's the pending amount, how much amount has been paid to each of the respective carriers. So that entire data is available over here. And if the broker needs to see the breakdown, that reporting is accessible as well. Then all the individual employees who have connected with this broker, their information is also going to be available. So the broker can help them out during their journey for completing their enrollment. So we have made a bunch of tools available to the brokers so they can support the Business Plus platform and the ICRA program setup throughout the journey of the employer. Next, we'll jump on to how the portal works for an employer. So on the dashboard of an employer, you'll see all the important information right away. Who's the broker of record in case the broker needs to be contacted for any information change or any fresh quote or changes in census. The census information, what kind of classes have been set up, what's the quote, All of that is available right away. And then the way the classes were structured, who are the current employees, if someone needs to be terminated or added, that can be done by the employer themselves as well. The employers can also create the quote in case they don't want to use a broker. Then there are other options as well, different messages, like say a payment is due. And if you want to see how much payment is due, you can see it directly from the dashboard as well. So we have given a lot of tools to the employers as well, so they can efficiently manage their payment and the end-to-end life cycle of managing the enrollments from here. Then as an employee, I'll jump on to an employee experience. So this is the dashboard of an employee who has already completed the enrollment with ICHRA. So right at the onset, you have access to the messages which have been generated from the system. If there are any notices which have been made available, if any documents need to be uploaded to complete the verification for the enrollment, then the broker of record. An employee is going to have the flexibility to change their broker in case they do not want to go with the broker which the employer had initially recommended. So we have kept that flexibility available to the employee as well. The current plan which this employee is enrolled in, including their total premium amount, the employer contribution, what's the responsible amount, and of course, the employee can choose to end their coverage in case they want to try for an alternate benefit available from the state. The rest of the information like demographics, tax, household section. Then for this particular case, the ICHRA was affordable, so that information is available. In case ICHRA was not affordable, this employee would have had the option to opt out of ICHRA. And in that case, we seamlessly transitioned them to the core HIC system where all of the information which they had already entered gets carried over within a single sign-on. So again, the employee does not have to enter any of this information again in order to get APTC or Husky or Covered Connecticut benefits. So we have tried to keep it extremely seamless for the employee experience. If someone wants to learn about how ICHRA affordability had worked, so that information and transparency has also been maintained within the portal in case someone wants to deep dive into the calculations. So thanks, everyone. John, that was it from the demo.
Thank you, Kunal. If anybody has any questions, we'll be more than happy to answer them. If anybody would like to see a demo, a more intense demo, we'll be more than happy also to schedule that. So thanks for your time. Yes.
Dr. Gifford.
Dr. Gifford.
Thanks, John. I know we've had several employers that have reached out prior to the formal launch. Have any employers enrolled?
So we have finalist presentations, 5 finalist presentations coming up over the next 4 days. This is the time where brokers now, pretty much after the middle of the month, start making plan options for their employers for 7/1. We feel like we are going to have groups for 7/1 enrolled.
Okay, so will you be able to show then what the costs, as part of this demo, would you be able to show then what the costs were before and then after enrollment in ICHRA for an employer? Because I think if I'm a small business person, what's really going to grab my attention is if you can say it was costing the employer $100,000 before and it's down to 75 or 60 with ICHRA. Will you have enough data to do that as part of your sales pitch once you have enrolled employers?
Yes, we will. Part of the quoting process, as we grab all the information, we ask them their current state, current invoicing, current plan designs, current drug formulary, because we'd like to do a complete analysis from start to end. So as they do the quote, they're able to evaluate on the first page of our quoting tool to see the cost differences from month to month and year to year and be able to see the savings. And then we take it an additional step further and do a benefit analysis on benefits, network, and drug formularies for them.
And is there any negative implications for the broker, financial implications for the broker of getting an employer into an ICHRA plan?
It's depending, it all depends on the size of the group and the household. Sometimes if could be a change in commission rates based on a carrier, there is a difference if it's a 1 life group, but if it's a 3 life, like say a household of 3 or 4, it could potentially be more money for that broker. So there could be, but it kind of tends to balance out. Brokers also have the option to what carriers allowed them to do is they can opt out of the commission structure and go direct and work out a compensation with the employer. Our platform allows them to do that also.
Thank you.
You're welcome.
This is Claudio, just continuing on Commissioner Gifford's good points, because I think as we think about how we're going to get the word out, it's great to have Access Health be a disseminator of information, but I think how we're going to change really the behavior here is business to business, the validation from the business community and getting and cultivating those champions in nonprofits and small businesses that have used it and have had a success. So I just really like to underscore that as part of our strategy moving forward. And anything, if I can be helpful in that, I certainly want to promote the work here, because I think it's the silver lining in some of the healthcare space that's happening over the next few years. So I'm happy to help. But thanks for laying this foundation.
Thank you, sir. Appreciate it.
Claudia, thank you much, Claudia. We know this is going to be changing behavior is very difficult. And we know that. So John has his team and the brokers. We've been working with them for 6 months now, preparing them for this. This is going to be in person, and go talk with them. And as we've said in the past, we are targeting the small nonprofits. We think they have the most to gain from the ICHRA platform, because a lot of them have a lot of low-income employees that would qualify from APTCs and maybe even some Medicaid qualifications as well. So we look forward to going after them. We have a whole strategy about reaching out to them as well. And there's some schools, some small schools as well.
Any further comments or questions?
The most recent.
Go ahead, James.
No, so the most recent addition that we're going to target is also the preschools, the daycare centers. We're going to look at them as well. We're going to work on getting a list of who they are, where they are, and then we're going to reach out to them as well.
So, John, thank you very much. Kunal, thank you for joining us today. Appreciate the demonstration. Again, I applaud James, your leadership in bringing us to this point, as well as your team. I think we are ahead of the game here, and that's a great thing. So thank you all. With that, Susan, I think back to you.
Thank you very much. We have an audit status update. So first, I'll let you know that the audit committee met last week on June 12th, 2025. At that time, Whittlesey, our independent financial auditors, presented the audit objectives and the impact for the annual independent financial audit and the annual programmatic audit, and the expectations for management and also for the audit committee, along with the timeline and the audit scope. A financial audit, just to remind everybody, is required under both state and federal law, and the programmatic audit is a CMS requirement for Access Health Connecticut as a state-based marketplace. Whittlesey has begun initial meetings and interviews with Access Health CT staff for the FY25 financial and programmatic audits. The timeline anticipates that finalized reports for both audits will be presented to the audit committee and the board in November of this year. I will pause if there are any questions on that item. Okay, so next up, as James mentioned, is our SMART, State-Based Marketplace Annual Reporting Tool. The ACA requires state marketplaces like Access Health Connecticut to keep accurate accounting of all activities, receipts, and expenditures, and to monitor and to report to HHS on those activities, and also to complete an annual report and engage an independent financial auditor to perform the financial and programmatic audits that we just mentioned. CMS developed an online annual reporting tool for state exchanges many years ago. To make this easier, they put all the requirements into one place, and it is neatly called the SMART. The SMART includes eligibility and enrollment policy, a report by the marketplace on its ability to collect and submit standardized performance monitoring data related to QHPs and APTCs and CSRs, financial and programmatic audits, as we mentioned, program integrity requirements, and also an attestation of completion. The annual SMART filing is due by June 1st of each year, and Access Health Connecticut filed its SMART for plan year 2024. This is done in a calendar year. We filed it on May 30th. CMS will now review it and get back to us in a few months, but we did not find any issues and do not anticipate any findings or recommendations. And then finally, our last item, James mentioned also the auditors of public accounts, the state auditors. They are currently working on an audit of FY22 and 23 for Access Health. And at this time, Access Health CT has provided them with all of the requested documents and information, and we await hearing back from them. I will pause for any questions.
Any questions? Susan, again, thank you very much for the update.
Thank you.
And John, I think back to you.
Yes, sir. Good morning, everybody. Director John Carbone, Director of Small Group Product Development, Broker Support. I'd like to begin by highlighting the success this year of our Connecticut Small Business Summit. Now in its third year, the summit has become a powerful forum for small business owners, brokers, carriers, vendors, and community partners to come together and share our ideas that strengthen the future of small businesses in our state. This year's event was sold out once again with over 225 attendees, 21 vendors, and 19 speakers, all gathered in one place, connecting, learning, and exploring new solutions. We were honored this year to welcome Michelle Nicholson, the Small Business SBA 2025 Small Business Person of the Year. Our keynote speaker, her journey with the Flower Girl Bakery and Cafe is a reminder in the resilience, vision, and determination it takes to thrive as a small business in today's environment. Whether you joined us networking or just there to expand your knowledge or explore innovation like our Business Plus platform, we hope that the summit left our small businesses feeling empowered, supported, and connected. Our mission this year is to continue to grow this venue and continue to move forward in the following year. So at this time, if anybody has any questions, I'll be more than happy to take them. All right.
Terrific.
So,
thank you very much.
Thank you. Shifting gears, I'm going to give a quick update on behalf of Tammy Hendricks, who couldn't be here today, but she'd like me to provide a few updates for her on the Broker Academy Year 4. Over the past month, our focus has been helping students complete their training through our Kaplan portal. Our state-approved education platform for students have access to study guides, quizzes, virtual instruction support, instructor support to help build a strong foundation before entering our classroom training. To keep students engaged in the process, we also hosted weekly review sessions. By the time they reached our in-person classes, they were confident and well prepared. Those in-person sessions took place last week in New Britain and Danbury, and thanks to our generous support of our community partner, Connecticut Leads, Connecticut Latino for Education, Advocate, and Diversity, a longtime community partner that generally donated the classroom space at no cost, which was a huge help to our bottom line. Over the past years, we have partners and hosted health insurance literacy presentations and in-person enrollment events there also. So we'd like to say thank you to them. This year, we've had over 52 students pass the class certification, which aligns with our results from last year. These sessions also served as a final prep for our state licensing test. We've registered over 52 students to take the exam during that class period, and I'm proud to announce that we have over 15 students who've already passed the test this week, and will continue to support those students in completing this process. We also gathered some helpful demographic insight on this year's participation. In New Britain, we had 28 students that came from across 5 different counties. The class was 85% female, 7% male, and 8% not reported. In Danbury, 24 students came from Fairfield and New Haven counties, which the class made up of 56% female and 26% male and 18% not reported. Looking ahead, we're preparing to enter into our mentorship phase of the program. We've officially, which will begin in July. We've officially completed our RFP process and we received over 11 mentor applications, which we're currently in the process of reviewing. So at this time, I'd like to say thank you for your support with this program, and I'll be more than happy to take any questions also.
Any questions for John? Well, thank you again very much for both presentations. Very helpful. James, the final word is yours.
Thank you very much. John, I attended both in-person training sessions, both New Britain and Danbury. And the New Britain side, they had two male, and everyone else were females, and from all different demographics. So the history of the insurance agency is usually mostly white male dominated business, and we're just very thrilled to see that the expansion, the diversity of the new brokers that are coming to Connecticut, and especially in the communities that we know there's a lack of brokers, and when people have to purchase health insurance, it's a very personal decision you got to make, and brokers have to ask you a lot of personal decision, personal information about yourself, and to speak to somebody that looks like you, that shares your interests, that from your community, it makes it a lot easier for them to really be very open, so that with the brokers, so that they can get the right plan for themselves and their families. So we are thrilled that more women are coming into this profession, and so not enough said about that. But it was just 2 guys in there. Everyone is women from Polish background, Latina, Black, and the entire spectrum in Connecticut, and similar to results in Danbury as well. So, future agenda item, we have the continued update on the evolution of the Big Beautiful Bill Act, as well as as we prepare for OE 13, OE 12, I believe. That's gonna keep us focused. So we'll keep you updated on that as well. And then now as well, obviously the audits that are coming up as well. Those are the biggest areas that we're gonna be focused on. As the bill moves forward, we will be working as a team to develop a strategy to minimize the impact this will have on our customers, but overall Connecticut residents. Thank you, Mr. Chair.
Thank you. And that brings us to the end of our agenda. Are there any questions, comments, additions that anybody would like to add for us today?
Mr. Chair, Claudio, just one last thing on future agenda items. I think as we get to the more granular beyond the top lines for what the reconciliation package may do, I think it would be helpful to look at some of the tangential and adjacent impact. For one that comes to mind, I know that there are certain protections for people who fall behind on their premiums. If they do have a subsidy, my understanding is that the ACA has provided an opportunity, I think it's a 90-day period, to come current, which would allow them to restore healthcare rather than just getting canceled if they run into tough times. So as we think about the subsidies decreasing, I think there's also a cliff in terms of some protections that extend to those that have subsidy, even if it's a minor subsidy that may be lost. So I want to look at the dimensions of impact, not just from a financial, but also what consumer protections exist, and if there's potentially ideas that we should be considering as a state to backfill the regulatory protections that may go away.
Great point, Claudio. And Susan, we're putting that on your shoulders a little bit along with James, but thank you. Good. It's good.
Sure.
It's a good
Sure.
comment.
Yeah, so far they haven't proposed anything touching that 3-month grace period Claudio's referring to, but who knows? Thank you.
Stay tuned. Yeah. All right. Well, any further questions, comments, thoughts? If not, I want to thank all of you for a very informative and efficient meeting. So thank you for that, and appreciate all the engagement from everybody. With that, I would ask for a motion to adjourn this meeting.
Mr. Chair, so moved, Ms. Claudio.
All right, Marcin, up to you. But I think we have a motion and a second in there.
Yes, we do. Is it Paul Philpott making a motion, and is there a second?
Second.
Thank you.
Any
Commissioner
discussion?
Reeves.
Yes, thank you. Any discussion? If not, thank you all again very much for the engagement.
Mr. Chair, we'll have to do a roll call. Charles Claypool?
Yes, Charles Claypool, yes.
Paul Philpott?
Yes.
Ron Ritter?
Yes.
EJ Gifford?
Yes.
Steven Hernandez? Matthew Brockman?
Yes.
Thomas McNeil?
Yes.
Dina Berlin?
Yes.
Andrea Porton Reeves?
Yes.
Sean King?
Yes.
And Claudio Gualtieri?
Yes.
Thank you.
Thank you.
Thank you. Nicely done, everyone. Bye-bye now.
Everybody.